Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
All right, Wild Health people. It is good to see you guys. Dr. Erin Falls back. And I have an awesome doc on today with me, Dr. Clayton Bell. So I got to know Dr. Bell through a mutual patient, actually, and really opened my eyes to some things in the world of tick-borne illness. So I'm excited to introduce him to you guys. Hopefully we can all learn together about some things that are kind of historically a little, we should say maybe complicated in traditional medical training. So Dr. Clayton Bell is a board certified family and integrative medicine doc. He's got over 13 years of experience in functional, holistic, and environmental health. He holds a lot of certifications, including from the Institute of Functional Medicine. He's recognized as a Lyme literate medical doctor, and an RGCC accredited practitioner, which we'll talk about why that's important in a little bit. I think that has to do with some of the therapies we'll talk about. His medical journey began at the University of Arkansas and included a family medicine residency in Maine and an integrative medicine fellowship in the University of Kansas. Go Jayhawks. Dr. Bell blends modern science with traditional healing practices. He guides this philosophy that the body knows how to heal, and he specializes in root cause, whole person care, and across emotional, physical, spiritual domains. Really, really a whole person, right? His clinical focus includes chronic illness, Lyme disease, autoimmune conditions, detox, mind body therapies, you name it. Really, again, just the whole person. He is a very compassionate doctor. He has earned numerous awards, including honors from the Society of Integrative Oncology and recognition for his humanitarian work in disaster relief and sustainable healthcare in Haiti. So obviously, a lot in your repertoire here. I personally and selfishly have learned a lot about tick-borne illnesses from you, Dr. Bell, but that's not all you do, clearly. And I'm excited to kind of dive into that, but some of these other things that kind of make you you as a doctor as well. It's good to see you. Thanks for being
Awesome.
here.
Yeah, no, thank you so much for Karen. I really appreciate it. I'm honored to be here.
Yeah, right on. So let's talk about uh kind of diving into why this became a little bit of a specific lens for you, if you don't mind. Like, did you go into medical school? I mean, we learn about what Lyme disease is in medical school and in family medicine residency, probably maybe experience it a couple of times, depending on where you live, certainly. That might influence it. But it's not, this is not a super commonly addressed topic in healthcare. So I'm curious if this is something you knew you were passionate about, or
No.
if you
Oh.
kind of happened on this, or if you wouldn't mind sharing that story a little bit.
Yeah, no, happy to do it. Happy to do it. Thanks for asking. I think I've heard it said before. It's not my quote, but someone said it very well. The best research is me search. And so when you have a personal experience, you learn a lot about that condition. You get really proficient in it. You kind of become a expert by default. And that's really what happened with me with Lyme disease. I really didn't know much about it, to be completely honest. I was told in medical school, you treat with doxy for 2 weeks, which is totally insufficient, by the way. But that's really all we learned about in medical school. And then residency, I did see a couple of cases that were really interesting. I had a gentleman with Bell's palsy, and we had a young girl in her 20s with third-degree heart block. And it was really interesting watching them get IV ceftriaxone and like watching that young girl come out of heart block each day when her heart rate was down like in the 20s to the 30s and 40s, 50s, 60s, 70s. So that was really interesting once we finally diagnosed her. But really, Lyme didn't come back into my radar at all. I was focusing mainly on cancer and some other things. Really until I moved to Asheville. This is probably about 3.5 years ago. When I got to Asheville, I was working in a functional medicine clinic here for Form Health at the time, and we started seeing a lot of patients come in with Lyme disease. And I didn't really know much about it, to be honest. In medical school, you're taught to do an ELISA test, which is an antibody titer. And if it's positive, you do the Western blot, which has the bands. And, that's the only thing I knew. I didn't know anything about like Igenix or Vibrant or any of these other, testing companies. And then what basically started to happen was we started to run like more advanced antibody panels, and not just a Western blot, which is only for Borrelia burgdorferi, which is just one of, say, 200 types of Borrelia, and one of 50 that causes disease. And so obviously that's totally insufficient, right? Because that doesn't cover any of the rest of the Borrelia that cause Lyme or tick-borne Leipzig fever, and it doesn't cover Bartonella, it doesn't cover Babesia, Ehrlichia, Rickettsia, Anaplasma, which are all kind of the main, co-offenders, co-infections with Lyme. And when I started testing people, at first I was like, is this right? Is this accurate? But it kept happening again and again and again, because what I started finding after testing 20, 50, 100, 200 people is every single person literally had exposure to Lyme disease. Now, I'm not saying they were all like floridly sick and debilitated with Lyme, like your classic, Lyme case. That being said, everybody had antibody titers to it, some more than others. And the only people that I had seen with only one or two bands positive of all the different species are sometimes typically my sickest people. And they might even have low antibody titers in general, like low IgGs or low total IgMs. So they just can't mount an immune response. And um, speaking of that, I see that too, just kind of FYI, I'm jumping ahead a little bit, but so many times the testing is really tricky. And I don't have any money in the company, but so often I will see like antibody tests come back negative, but we'll get a fish test come back positive through Igenix. And so if you didn't do the fish analysis, you would miss the BART or the Babesia. And so I'm still like perfecting and crafting, like, how do I get patients the best testing for the best price point? Because a lot of it, honestly, it's a resource game. The best top testing
Sure.
out there in the market costs almost $3,000. If someone has Medicare, we can get Medicare to pay for free, which is amazing. But most of us that are younger than 65, you have to pick testing that's not quite as good, to be totally honest, because the patients just can't afford the best test out there. But anyway, all that being said, what happened was I tested myself, and then my Vibrant panel lit up like a Christmas tree. I had like 6 different species of Borrelia, multiple different forms of Lyme and tick-borne Leipzig fever, and I had multiple species actually of Babesia and Bartonella as well. And it was really a wake-up call. It actually helped make a lot of sense to me. It told me why 12 years ago, when I had been living in Maine, during residency, I'd lost 40 pounds that year, and my testosterone had dropped literally into the 100s, and my thyroid was really sluggish. I kind of had hypothyroid, and my adrenals were like overcompensating, so I was continuously kicking out excess cortisol, to the point that I even had like almost osteoporosis in my spine in my young 30s, and I was like, expert mountain bike racer, so that didn't make sense to me, why I would have such brittle bones. And then there was a lot of other things too, like I just couldn't put on muscle mass, didn't matter, and my digestion was just trashed, constant SIBO, candida, those kind of things. But I couldn't ever figure it out. And I would run all this other like functional medicine testing, but I never had that unifying diagnosis of like Lyme disease and all these co-infections to really help me identify it. And it was really interesting. So several months into the therapies, and I did a little bit of everything. I did some antibiotics, I did herbs, I did SOTs, which we can talk about. Now they're called cure strains, but it's the same therapy. About 6 months into doing that, my health kind of caught, and I just started to like put on muscle mass again, and my testosterone got into a normal range again, and my thyroid normalized, and my body physique changed, and my stress went down, and my gut started working again. And it was really interesting. And it wasn't like trying to do those things individually never worked, but actually treating the Lyme and the co-infections, all those things began to literally kind of re-equilibrate themselves and kind of reach a new homeostasis in the body. So that really became kind of a foundational component to how I treat patients now, whether it's Lyme or co-infections or mold, is try to find the root cause, remove that, and then their body wants to heal themselves. You just have to remove the offending agent and usually get some support along the way.
Super interesting, and thank you for sharing, like, your own perspective on that, and your own experience with it, right? Because I think it's so powerful if you've been through something personally. I think you can relate to patients in such a different way, particularly when it comes to this and other topics, as well. It's not just tick-borne illness, but this one is kinda kind of known for patients not feeling the most heard, not getting answers in a timely manner. It can be, quite frankly, crazy making. And then you've got the neuroinflammation with a lot of these on top
Mhm.
of it that's affecting mood and affecting people's cognition. And it is a really, really difficult place for patients to be, in my experience, when they finally get some answers with this. So I imagine there's a level of comfort for your patients when they know you've been through something similar. I imagine there's some trust that builds from that.
Yeah, there really is. Sometimes, I'll even be doing like a discovery call with a patient, or we'll start the conversation and they got referred by somebody or a friend or, the iLads website or what have you. And they'll be like, "Do you really have Lyme? Like, I heard you had Lyme, or I watched, a video that you did on it." I was like, "Yeah, I do." Have it, had it. I think it's kind of like cancer. Once you have it, you don't ever really get rid of it, but you don't have to be sick from it anymore. Like, there's still always going to be spirochetes in my body. Like, I don't have any false illusion I'm going to get rid of every single Lyme bacteria. I think that would be kind of like you're going to clear out all the EBV or varicella zoster virus. It's like, that's not going to happen.
Yeah.
Well, but you don't have to have a shingles flare, right? You don't have to have an EBV flare. You don't have to, have Lyme symptoms again. You just have to make sure the immune system's stronger than like the allostatic load, including obviously, the, but yeah, patients definitely feel really reassured. So often I'll have people that come and see me that either like feel really confident they have it, like, maybe they've done the Horowitz questionnaire and their scores are through the roof, or, they're like, have all the criteria, and my doctor did an ELISA or Western blot and it was negative or it was indeterminate. I had like several bands, but, just no one's ever really honestly tested them, to be honest. And so, kinda like you said, they feel really, really gaslit. They feel like no one's listening, and,
And
for
even if they did get tested, it's probably not the most accurate testing. I mean, I think what, 50% positive
yeah,
rates on the standard testing
yeah, it's
is
about
what the
roughly.
research shows, which is probably an overestimation, would be my guess.
Yeah, it's even less than that. I think it is like in the 40s. But yeah, it's around 50%. And so that's what Dr. Aaron's referring to is if you do like an ELISA and Western blot test, which is what your doctor's trained to give you. So that's totally appropriate, right? Per their training, our training, right? So unless they're Lyme literate, that's the standard of care in America. Um, with a screening test should be at least 95% sensitive. And so if you have a screening test that's less than 50% sensitive, it's kind of worthless. The screening test, it's good if you get a positive. If you get a positive, it's a slam dunk. You have it. It has a really high specificity too, which means that if it says yes, it really does mean yes. But if it says no, it's literally like flipping a coin and you land on the tails and you're presuming there's no heads on the other side. It's just not. It doesn't mean anything.
Okay, so you've mentioned a couple of these, but for people that might be struggling with this,
Yeah.
and might want to have some questions to bring to their doctor or look some things up, arm themselves with knowledge, I always have to say this isn't specific advice. This is more just kind of general information, but I think this stuff's really hard to understand. I mean, even for providers, quite frankly. So I like to go there. You know, the testing ELISA and the Western blot is what we learn in medical school,
It
right?
is.
If you go to your family practitioner, odds are if you ask to be tested for Lyme, this is the road they're gonna go down. This is what we're saying is not it's just not very accurate, unfortunately. Like Clayton's saying, if it is positive, then we know it's real. It's probably significant.
Mhm.
But if it's negative, that doesn't mean you don't have any active infections here. So what do you recommend patients do? They get this test back and it's negative, like, what options are there? And, like, what kind of price point are they typically looking at
So
for this kind of testing to get accurate
yeah,
testing?
that's a great question. I mean, because honestly, that just comes down to like nuts and bolts, and that's for better and worse. I mean, that's just kind of the system that we operate in, right? If you have more resources, you can
Sure.
get better testing and better therapies. Um,
Yeah.
if everything was free, in my personal opinion, there's no question about it. I would get the iGenix. I believe I call it the Immunoblot 6, but I think it's the TBDI6BL. Anyway, it's the
That's
one.
the fish test. That's the
Yeah,
fish
it
testing.
does have that, yeah, so it's great. So it has immunoblots, which are, like, superior to Western blot, but it has these immunoblots for Lyme, but not just Borrelia burgdorferi, like, multiple different Lyme species. Um, and it has immunoblot for tick-borne relapsing fever, which is, like, a whole 'nother thing. They have similar symptoms, they just have quicker, like, replication cycles. So in theory, the flares should be more frequent. Now, to be honest with you, in reality, I don't very often get Lyme that follows the textbook as far as like 7-day cycles
Sure.
versus 30 days, but anyway, that's there. So you get that, which is great. I don't really care. I want to know what they have so I can treat it. And then, we also would get like Babesia immunoblot with that, and we would get the Bartonella immunoblot. But in addition, you get PCR for Lyme, which honestly never really comes back positive. I don't really ever see that come back positive. Usually the antibody testing, I feel like, is better for Lyme. But you get the fish for the Bartonella and the Babesia. And I think that's where the Igenix test really stands out above some of the other companies. And once again, I don't have any financial interest in them at all. Um, but I just think it's a better test, but you get what you pay
Mhm.
for, right? I mean,
And a lot of these patients have co-infections, right? They have
yeah,
more
oh,
than
so
just
many.
one.
Yeah, most do, most do. Yeah, so you don't just have Lyme. I mean, because like if you just had Lyme, you probably wouldn't be sick. Now it's possible. Like, don't get me wrong. I've seen kids that show up in the ED with a swollen knee, and they just got bit by a tick a week ago, and they test positive. So maybe they never got tested for the
And
co-infection.
these are kind of the classic cases we learn about in medical school, right?
Right,
In
yeah, so that one actually
traditional
has that one's actually happened a
medical
couple
school.
times. I've literally had that kid that's 8 or 9 years old
Sure,
fill up with that, and that's really cool, and kids are so much easier to treat. I mean,
sure.
you can give a kid like Doxy or other antibiotics, and they respond really well, and they don't tend to have a lot of residual symptoms. Adults are so much harder to treat, and most of the time it seems
Yeah.
they've so many of my patients, at least, Dr. Aaron, I don't know about you, but they've gone months or years, sometimes decades prior to the diagnosis. So at that point in time, it's a lot more challenging. And there's always other variables too, right? Like I said, they don't just have Lyme, they have co-infections. And they usually have mold, because mold and Lyme, like the symptoms are so much overlap. And it really is kind of like multiplicative in nature. So it'd be like, you know, instead of 9 plus 9 is 18, 9 times 9 is 81. Their symptoms are a lot more exaggerated, and you really have to address the mold before they're going to get better from the Lyme. And a lot of times, people might have, chronic stress in their life, right? Or, so often with any of these conditions, my patient population tends to have high ACE scores. So I would definitely, as a provider, make sure that
Yeah,
you have
and
a
we've
ACE
talked
score.
about ACE scores before, adverse childhood experiences or events. Basically a history of trauma in
Mhm.
your early formative years,
Mhm.
predisposes you to pretty much every chronic medical condition on the planet, including increased risk of overall all-cause mortality. So, that's what he's referring to when he says ACE scores. But I think you're bringing up such an interesting subject, and I want to pick your brain about it. So, one, I totally agree with you. I found working with children, where I also did family medicine residency initially
So cool.
before I became a hospitalist, before
Mhm.
I went into precision and functional medicine.
Yes.
But I found working with children so fascinating because they're a blank canvas typically,
Goodness.
right? Like
Mhm.
their systems are functioning well, and then there's this like specific insult that you can target. So such a different mentality than looking at, and I don't mean to talk about not the human aspect of it, like just from a scientific perspective, it's such a different way of approaching things than when you have years of epigenetic changes and trauma on the body and different things coming together to form this host that's responding in a very different way to this insult or multiple insults,
Multiple
right?
ones. Yeah.
S- So it brings up such a good question. I get curious about this a lot when I get mold testing back or when I get Lyme testing back. And I heard you mention a couple of times on this call, almost everybody you test has Lyme titers. That just the scientist in me that raises the question of, is it the host versus is it the like germ theory versus
Well,
terrain
yeah,
theory,
right.
right? Like how much of this is I mean, I think we can agree this is a pathogen. This isn't something that's supposed to be living in our body, right?
I wouldn't
Um
think so. I mean, I think from my understanding I've read a few like books and they go into some of the history of Lyme, but I believe some of these like frozen ice men or women they found actually had some like Borrelia even in their body at the time.
Yeah,
These
so
are
I was when
thousands
you
of
said
years
that,
ago.
I was like, "Well, what did people do when they were living outside and this and that?"
Yeah.
Like this is so it just brings that question up to me. How much of this is all these chronic insults in modern day society that's letting
The
our bodies not tolerate this well versus and how much should we be handling and supporting the host versus
mm,
treating and eradicating the germ, right? Am I
yeah.
asking this
No,
clearly?
totally. Totally. No, I'm following you 100%. Yeah, no, I think it's both, right? Obviously, it's definitely the host, it's the person's immune system, it's how many other insults they have they're having to deal with, right? And then it's also like, the pathogen, right, and the load. Like one good example that I use to explain it.
Like how much
Exactly.
of it there is.
Yeah, kind of like an analogy I'll use a lot, because COVID has been in the press so much over the last 5 years. But
Mhm.
if you are at a function and someone who has COVID sneezes in your face, you're probably going to get COVID. If someone sneezes across the hotel, you might pick up a couple particles, right, or across the warehouse, but you're probably not going to get COVID from that load. And it's the same virus, right? But it's just like, did you get 2 or 20 particles versus two
Yeah.
million? So
I'm
that is gonna.
I'm laughing because, not because it's funny when people get COVID. I'm laughing because the first time I got COVID, I got it terribly when it was Delta,
I did
and it
it.
was because my sister, I didn't know she was doing this. She
Yeah.
pulled out a test next to me. I picked her up from the airport, and
Oh,
she was
yeah.
like, "I feel fine." I'm like, "You need to take a test." Like,
Yeah.
I think which is she had I picked her up from the airport. Don't miss that. I'm like so
Sure.
frustrated with her,
Sure.
right?
Sure.
And I'm like, "You need to take a test." And she takes the test, and of course, they make people sneeze, right? She
All right.
sneezes all over me
Oh
after
my god.
I got so bad. And anyway, so it was kind of before we knew so much, and it was
Sure,
like
sure, sure.
early days, right? But
Absolutely.
anyway, I laugh because yes, I think I got quite the viral load in that
Yeah.
specific enclosed
Mhm.
container of the car.
And and another one that's really funny. Not funny that you got it, but funny that it's but
Oh,
now
I'm
we can
fine.
laugh about it.
I'm fine.
Wasn't as funny, not funny. Was not funny at all then. But, yeah, it's just kinda the same way with, like, the mold too. I feel like, 'cause I pretty much test every time I get someone Lyme now, I'm pretty much testing them for mold, especially where we live. I'm over here in Asheville, North Carolina. We're right on the edge of a temperate rainforest with the Smoky Mountains. Great
Mhm.
Smoky Mountain National Park. It's amazing, but it's so moist here. There's so much rain, there's so much water. Most homes in the US have some water damage in them. The question is, do we know about it or not? And that that water damage in the home that we live in, a lot of homes don't breathe anymore, right? Like, fill them up with like styrofoam insulation and everything else. So there's no way for that
Mhm.
moisture that gets locked in to get out. If it gets in the sheetrock and everything, there's a lot of spores just in the compressed wood in the sheetrock. Anyway, so they can begin to release mycotoxins. And so I have a lot of people that they don't think they have mold. I'll test them. They come back positive for mold in their urine, or mycotoxins, not mold, but mycotoxin in their urine. And then they'll check their house. They'll have a professional come out to their home, like someone that's like an environmental inspection, expert who specializes in these, like, environmental medicine and mold and those kind of things. And inevitably, they'll almost always find mold in people's homes. Now, once again, there's mold in the air, there's mold in the atmosphere, there's mold outside, and everybody's house has some small level of mold in it, but some have much more. And so when someone has that, whether it's an ongoing mold exposure in their home or workplace, or I take care of some teachers who have it in the school, which is tough because these schools are typically older. Maybe the maintenance hasn't been taken care of as well. There's not so much funding for updates, for us to get,
Yeah.
with kids or in school too.
Yeah, I mean, so I think maybe it's a both and conversation, right? Like, yes, maybe it's like the host doesn't have as much resilience as is necessary to support whatever that either toxin from the mold or pathogen from the Lyme or fill in the blank, right? Um, so maybe me and in real time we do target both. Like we do try to decrease the load of the insole and support the host resilience. I'd be so curious, like you did your SAT therapies and you started to see your health gain momentum. I'd be so curious now if you had this exposure, would your system be as susceptible to it,
Yeah,
right?
it's a really good question. Yeah, so I mean, I think there's definitely a lot more resiliency in my system now, for sure. I mean, I can tell that just from the way I feel, from the way I look. Like my body composition is just different now than it was.
Yeah.
40 pounds lighter, obviously. I'm only 5'7", so I shouldn't have been that light. I mean, so but anyway, yeah, no, I think it definitely changes. And what's interesting too is, like, even when I sequentially test myself, sometimes these infections will go away on the test and they'll come back again. So, for instance, the last time I did a PCR analysis on myself, um, and it was through Biocentaur, which is a sister company to RGCC that makes the Q restraints or SOTs. Um, but I was doing a PCR analysis to them, and Borrelia accelerated came back again for me in my cells. And the previous test was negative. So did I get reinfected? Maybe, probably not. It was probably just like more prevalent in my system for whatever reason, and they were able to pick it up on that PCR testing with my
Yeah,
blood.
for whatever reason, that overall allostatic load. I mean, it just
Yeah,
waxes and wanes, life, right?
express. right now.
Right. Like I have a history of lupus diagnosis
Right.
remotely.
Good.
I think I'll always have it. I don't really believe in true like curing there, but I generally when I check my antibodies, they're unremarkable. And
Mhm.
then if I'm pregnant, they're not. Like when my
And
body's under stress
interesting.
or,
Right.
early postpartum, my antibodies go back up because the body's under a way greater stress load and I have to be
Mhm.
a lot more careful with my immune system. So I look
And
at it. Maybe it's similar to that, right? Like it's just how the body's processing. Interesting. So I was just selfishly curious about that. And for anyone that might be listening that's struggling with this, when I'm speaking about is it the host susceptibility? That's in no way blaming terminology. It just is a matter of how it's someone's fault. It's just a matter of how to best approach a case and how to best approach a human to feel better with doing as little intervention as possible, especially when it comes to things like antibiotics, right?
yeah, so and I think, I mean, really, it's not even like an individual problem now. It's almost like the canary in the coal mines, though, are often the people that we see more, right? But it's like a lot of it's really a societal, cultural, environmental issue now. I mean, there's nowhere to go, right? Where like COVID didn't spread, there's no safety bubble you could be in. There's nowhere to go that there's not, basically glyphosate in the groundwater now.
Hmm.
There's not trying to be like gloomy doomy at all. Like that's not my jam.
Yeah,
I'm all about empowering people, but like there's just a lot more chemicals in the environment and in our body
it's a
that
different environment than it used to
yeah,
be.
we don't the current environment is not conducive to health. So you really have to be an outlier and pretty much identify what everybody's doing as far as what they're eating and how much they're sleeping and how stressed they are at work and try to basically intentionally do the opposite of the average person in our culture to
Yeah.
are as healthy as possible.
Pretty good. That's a pretty good prescription. Awesome. So I don't think this needs to be a super long part of the conversation, but I am just curious since you address this a lot. Like I found myself intimidated by just as a practitioner. I had a patient that was sky high, so like very obvious positive testing, very obvious symptoms for tick-borne illness, really struggling. Kind of classic manifestations of symptoms of neuroinflammation. And sent this patient to an infectious disease doctor that had a very, very good reputation in her community, with like a warm handoff
If it's
and just flat out refused to see the patient. And I
really
just found myself like saying this doesn't exist. This is
wow.
not, there's nothing to this.
Mhm.
And it just brought up this question for me. I generally believe that people are good, but I
Mhm.
also generally believe doctors care. There's a lot easier ways to make money and have clout, right? If that's your game. But most doctors I know are good people and care about their patients. And
Okay.
so when I hear a response like that, it just it makes me so curious, and I know it's not isolated. I know that might be extreme, but there are a lot of scenarios where the general, like, traditional medical system just doesn't really look at this. Um, so given that this is something I don't see day in and day out, but you do, I'm just curious if you have insight as to, the why there or just what your thoughts are there because I just found it I try not to be too disheartened by it, but, it helped me grow as a physician and learn, which is great. And we got the patient the care that they needed, but I'm just curious your thoughts there.
Totally, I'm happy to share that. I actually have a lot of insight into that from a couple different angles. It's Lyme is one of the more controversial topics, right, in medicine. COVID, obviously,
Yeah, it's
super
probably a better word than complicated. It's controversial.
it's contra it's very complex, right? It's not simple. It's not near simple as what we got taught, right? So that's one issue. It's very complex and it's very complicated. There's lots of layers to it. Um, and then it's very controversial. So for instance, there's very different guidelines between like the Infectious Disease Society of America, and then like what they would recommend for a Lyme infection, and what ILADS would recommend for Lyme infection. And ILADS is, of course, the International Lyme and Associated Diseases Society. So it's basically where all the LMDs worldwide are members of. Um, so anyway, so different guidelines for testing, different even like if you look at IGeneX tests or even Vibrant tests or any of those, like they'll even have different criteria for what they consider a test to be positive. If that makes sense.
Mhm.
So some people might get like a Western blot that's negative, but the Western blot we talked about earlier doesn't include even some of the most prominent bands and most important bands like P31 and P34, which are actually used in the Limericks vaccine. that was developed, I think around the 2000 mark. Anyway, so that was given to a lot of like people in the forest service for like the government and everything. And about my understanding is about 20% of people started to develop Lyme symptoms after
Mm.
multiple rounds of that vaccine. So it got pulled off the market really quickly. The American public never got it.
Interesting.
Yeah. So the American public never got it, which is good. But they pulled it. I felt really bad for the people, and I don't have any idea if they continue to have symptoms or if they resolved after they quit doing the injections. But so anyway, that Limericks vaccine literally had bands 31 and 34 as antigens they put into the vaccine to activate the immune system against Lyme. And so what happened was they never actually reinstated those bands into the Western blot. And so they don't even get included in there, and they're two of the most important bands. Anyway, so once again, the Western blot test is just not a good test, and there's other quasi-political things that go
Come
into
full circle.
insurance reimbursement. Yeah. So anyway, but to answer your question, before I got really into Lyme, which is controversial, I worked in the cancer center for about 6 years at University of Tennessee Medical Center. And I was the functional medicine doctor, the integrative medicine doctor for the cancer center, which is really awesome. I got to work with all of the surgeons and the oncologists, radiation oncologists, so on and so forth. And most doctors and patients also have very polarized opinions of, let's say, the traditional, I'll call it neo-traditional, right? Because traditional medicine would be like Ayurveda and TCM, but like what we call traditional cancer care now, chemo, radiation, surgery, and then what was called alternative medicine, and I would kind of live with a foot in both worlds where I would try to combine the two, help people get the best of both worlds. But so what I found, kind of tiptoeing around the Cancer Institute, not offending people, and then what I see now, sometimes we do referrals out to people and they're like, oh, I'm not into that. That's not real. I don't take it offensively anymore. What I think it is, and I was guilty of this myself. Like I remember, and still do, I'm sure. But basically, I think what happens is doctors are usually a certain personality type. We like to know things, and we're put in positions of authority, and we're expected to be competent. And there's a huge pressure for us to be competent, right? If someone brings information that is contrary to our belief system, now you can think about that with like a nutritional, like your diet of choice, whether you're vegetarian or vegan or keto, right? Someone brings a new research study to the contrary, you tend to be dismissive of it. Same way, religion would actually be the most classic example, right? I grew up Church of Christ, right? And that was that had a very strong set of beliefs. Most people that I went to church with, if you tried to give them Catholicism or talk to them nevertheless about like Buddhism or Hinduism, they're going to shut you down real fast. It's not really so different to talking to an infectious disease doctor. They're not
Yeah,
trained
that's
in.
an interesting perspective.
Yeah, so when you're bringing them this new testing and you're excited about it, it's basically a violation of their belief system, and essentially
It's outside their dogma.
yeah, it's outside their dogma. It's a threat to their ego. You know what I mean? And I don't mean ego in the sense of like, oh, I'm awesome, but
Sure.
like
Yeah,
really
I
like
understand.
like the Freudian
So
ego.
it's just protection. It's just
Yeah, it's just a.
self-protection. Yeah.
So I always tell people, don't get offended if your other doctor doesn't believe you. Like it's okay. And now with Lyme, at least, like if someone has an infectious disease doctor because they're gonna do like IV antibiotics or something, like that's awesome. But in general, I
Mhm.
don't refer people with Lyme because I haven't I haven't found people in our area that I feel like are. Maybe I just need to find that I need to start working with the right people. I haven't, but usually I'll just treat it myself. But that was a comfort thing too, right? Like I used to have no idea how to treat Lyme. But then when now I see probably 2 or 3 people a day that have some various stage of Lyme disease. It just kind of became my niche. Um, so that's just who sees me. They find me. It's funny how we draw different patients, different clients to us as we evolve in our
Sure.
personal lives.
Sure. Thanks for sharing that. Um that's interesting and helpful perspective. I have this theory that when any level of conflict arises, it's always someone's like I like to picture someone's like inner like 7-year-old
Oh yeah,
running the show, and like with love, right? Like I don't mean that I'm not mocking anyone. Like it's me, I'm guilty of it as well when I react to things, right?
yeah, yeah.
And it almost always does come down probably to some level of
Hmm.
self-protection, right? Like we're
Totally,
just it's
totally.
human nature. So,
It's the same way when,
super
I
interesting.
get in a disagreement with my partner. It's the same way. She's angry, and it's like
Yeah.
our little kids are basically.
Yeah. Yeah, yeah, I know. I am like, wow, are like the big powerful decision makers of the world, are there
Yes,
inner 7-year-olds running this show?
run
I
the
hope
show.
not.
Mhm.
Anyway, cool. So we talked about kind of some of the like philosophy behind this. We've talked about testing. You're a big fan of hygienics. You've mentioned Vibrant a couple
Yeah,
times.
so typically, just
Um,
so you know, just from a nuts and bolts
yeah,
standpoint, if a patient has this are all the doctors out there, providers. Um, if a patient has Medicare, I would just set up an account with Hygienics. It's really easy. You can literally give them the customer service number. You can drop ship them a test kit. They can give their Medicare number to Hygienics. Hygienics will verify that Medicare
that's
will
so
cover it.
awesome. I didn't know that.
Yeah, and then you just get the good tests. Get that
So cool.
TBD, 6 IBL, whatever it is, the $2,700
So
test.
cool.
Yeah, and so that's a freebie. If you have patients, or if you're a patient and money's not a thing, that's the test I would get, bar none. If money's a thing, which it is for most people, what I typically do is I typically recommend the Vibrant panels, because I feel like they're the best bang for your buck on the market. And typically, a lot of times, I'll just run like a Vibrant 1.0. They have a 2.0 as well, which has it's like about $1,000, where the 1.0 is about 550. And the 550 is going to cover like the various strains of Borrelia, which is Lyme, tick-borne fever, Bartonella babesia, some Ehrlichia neuroplasma. But the 2.0 is going to cover like some rickettsia as well, and then some of the viral infections that can be there, whether it's mycoplasma pneumonia, or HHV6, or those kind of things. I I'm sure those are big players, but I typically find that if we can go after, like, call it the big boys,
The big dog.
yeah, go after them. It's like, yeah, everybody's got EBV, but like, generally, I'm not gonna give someone like antivirals for EBV, right? Like, I'm gonna go after like, why is their EBV flaring? It's probably because they have mold or Lyme or something. We'll go after that. So anyway, so I basically order that, or have patients order that Vibrant 1.0 panel for themselves. And it's like I said, it's 550 or so, which
Yeah, that's a lot lower than the
a lot
the
lower than
hygienics for
$2,700.
sure.
Yeah, and I've heard it
Yeah.
called, I have a friend Dr. Peterson, who is a past president of iLabs, and we worked together previously, but he's a great guy, and, he calls it the Honda Accord of tick testing, and I think that's really what it is. It's not fancy, but it's a really good car, and it does
Very
everything.
reliable.
Yeah, really reliable. Yeah, so
Yeah.
it's a good one.
Awesome. Okay, let's shift gears to someone suspects this or they have a positive result. Like, what do we do next, right? And we talked a little bit about this. It's not just treating the pathogen or the Lyme or whatever the infection is, right? It's treating the whole person. It's looking for other insults like mold, etc. It's supporting stress levels, supporting sleep, and I'm sure a lot of these patients that have been kind of unintentionally put in the driver's seat of their own health, which in and of itself becomes a stressor because they're having to be vigilant all the time, and become an expert in something they probably never meant to be an expert in. Um, but neither here nor there. The whole person does need to be treated for this to work. I feel really strongly about that. Sounds like you do as well. But tell us some of the, like, interesting science behind how do we approach treatment for the infection itself? Because this is, I think, where a lot of doctors have no idea what the best course is because, quite frankly, the literature, like you said, says a couple weeks of doxy, right? And this is just not cutting it for these patients. And so what do you do? What do you see work? I'd love to hear you talk about SOTs a little bit. In your experience seeing more of these patients, what
For me?
what have you seen move the needle,
Yeah,
and
no,
and what are the risks of those things?
yeah, it's a great question. So that is a really big topic that we could spend a lot of time on, but I'll try to kind of give a
Yeah,
1,000-foot overview.
totally. Yeah, whatever you think is best.
Yeah, so what I think the first thing is you need to know like what infections they have, right? So is it just Lyme? Is it Lyme and Bart, Lyme and Bart and Babesia, whatever, right? And then what I like to do is try to determine if I can, based on their symptoms, right, and based on their testing, which infection is the most prominent in their body at that point in time. And that's the one that I would go after first. So, for instance,
Okay.
if a patient comes in and they're having like night sweats, and they're having crippling panic attacks they never had before, and they're having this like shortness of breath, they just can't catch their breath. Well, that's Babesia, to me, and until proven otherwise, that's Babesia. So that's the one I'm going to treat first. So even if they have Lyme, I'm going to go after Babesia first. Then,
Would
you know,
you mind I'm sorry to interrupt you,
yeah.
but I feel like patients are really gonna find what you just said super interesting.
Mhm,
If there are other super common presentations of, like,
mhm.
Babesia, Bartonella,
Yeah, sure.
Lyme, or any other super common ones you see, can we pivot just slightly, and I'll get us back on track? I
Yeah,
just think
no, sure,
people
sure,
will
sure.
really wanna know this.
Yeah, no, totally. Yeah, so there's a lot of overlap, first of all, okay, between like Lyme, Bartonella, Babesia, the other tick infections. Like, there's a lot of overlap, and mold too. Unfortunately, there's just a lot of overlap of symptoms. That being said, things that you can tease out. So some of the reoccurring, and I'm really good at pattern recognition, but some of the reoccurring things that I see over and over again, the BCA is going to tend to have more of that like temperature dysregulation, like the sweats. So think like, like menopausal, like night sweats, that kind of thing. But people are going to have more like from a psychological standpoint, it's tend to going to be more anxiety in nature. Like there's just a lot of anxiety I didn't typically have prior to the infection. Um, and there's no like specific source for it. It's just, even panic attacks, see that. And then it's like that shortness of breath too. And not everybody has all the symptoms, but those are kind of some of the main three that I see. With Bartonella, it's usually from a psychological standpoint, 'cause there's so much neuroinflammation. Bartonella really likes the central nervous system and to get into the nervous system. And so there's a lot of neuroinflammation in the brain. And so what I'll see there is more like anger, rage. There's even something called like Bart rage. And this is an extreme example, but I've had it where children have literally chased their parents with knives. Now, they're not
Mm,
bad kids. It's not a Chucky movie. They literally
sure.
just have an infection in their brain. It's inflamed. They don't feel safe, and they're just yeah. And so if you treat the infection, and I've even used things like beta blockers to like bring it down a little bit, and they seem to do a lot better. But yeah, it's interesting. But that's really sad too. And then people just like fly off the handle, can't control their emotions, really angry. One of the things that I see classically a lot, it's mentioned, is like pain in the soles of the feet with Bartonella. One that I see clinically a lot more too is a lot more like kind of like zaps in the nerves. Or like this buzzing sensation under the skin. It's almost like this nervous system probably tingling. I'm guessing it's inflammatory in nature that's driving that feeling. Lyme and tick-borne lapsing fever, typically things that I see with that, it's going to be like the musculoskeletal pain. Although it's not like arthritic pain where it's in the same place all the time. It's tend to move around the body. So it's like migratory musculoskeletal pain. It's like maybe it's the elbow, then it's the knee, then it's the hands and the ankles, and it's always just kind of moving around the body. Women tend to have a little more like prior to going into their menses as well. I'm not sure if that's because like the drop in the hormones with estrogen. That's what I've heard postulated previously. With that, other ones with Lyme, and it's gonna happen with all of them for sure. But with Lyme, a lot of times we'll see a lot of fatigue. We'll see a lot of brain fog, like cognitive changes too. And then there's a lot of overlap with that with like the mold too. I know I keep mentioning the mold, but like you can't treat Lyme without treating mold just because they won't get better. And with mold, it's the same way. Fatigue, a lot of mental changes, they just that brain fog. And then they can also have the really weird symptoms. And so if someone basically comes to my clinic and like nobody knows what's wrong with them and they tell me like how weird their symptoms are, then like I'm thinking, okay, it's probably a tick infection or mold kind of right off the bat. And so that's what I'm gonna test for.
Interesting. Okay. Thank you. That's helpful for me selfishly, but I also think that will really resonate for people because I think a lot of people don't even know you don't know what you don't know, both
Yeah, you
clinicians
don't yeah,
and
totally.
patients, right? And I think people might have a lot of vague symptoms and they get traditional labs and they're normal and they have no
They're like,
idea
it's
what to do
normal.
next.
Yeah.
And or they're maybe told this is just stress,
Mhm.
lower the stress in your life,
Mhm.
which is I'm sure such a great thing to hear as a patient. And
Yeah.
so
I know, right?
I think it'll be helpful.
Let me talk about some of the treatments too, because I didn't really answer
Yeah,
that at all.
please.
So as far as treatment go,
Please.
what I would say is try to find the one that's the most prevalent, or like, for instance, if the symptoms are all the same, right, and I don't have any indicator where to go there, then I'm looking at testing to lead me. I'm going to go with something that's either like a direct test positive, so a fish test positive or PCR positive. So I would go after that first, typically, and then I would go after IgMs, which are antibodies that typically show like recent exposure or current infections, and then I would go after IgGs. Now, I won't get into all the nuances of some people can just stay IgG positive chronically for years and they don't have any IgMs, and other people can just retain IgMs, they never seroconvert over. I won't go into any of that. But that's basically kind of the way I would do it. I would do like direct testing first, so PCR, fish, positive, and then I would go to IgMs, and then I would go to IgGs based on that. And then if I have, and if there's like kind of things are equal, like they have some co-infections and Lyme, and they also have some mold, and it doesn't seem like one is a lot stronger than the other one. If they're anywhere even close to normal to like equivalent, like, oh, they have like, let's say, pretty prominent, Lyme and Bartonella over here, and then they have like maybe several different categories of mycotoxins over here. I'm gonna go for the mold. So I'm always gonna treat the mold before I treat because it's just gonna speed up the recovery so much. Um, and a lot of the things that you're gonna use for mold anyway are gonna help with basically the Herx die-off reaction from the tick infections too.
So
Whether you're
different binders,
binders or
removing
doing the crown
exposure,
after.
sauna. Like, what
Yeah,
are you
sauna. Yeah,
seeing really?
exactly. Yeah, and go depending on the person. Sometimes going after the mold can be more gentle, and they can make big gains before you even attack. Because I had so many people that are so sensitive, and so some people can't. And this kind of goes into it too. Some people, when they've had infections for a long time, especially if they've had mold for a long time too, they develop like mast cell like hyperactivity or mast cell activation syndrome or chronic inflammatory response syndrome, which is basically like cell danger response. And in a nutshell, it's like their cells just like freak out to everything because everything's a threat, right? Because they've been,
Mhm.
and that's a totally normal response based on the insults that they've had to like resist, and so they're doing perfect. Their body's doing exactly what it needs to do for them to be there, but it's just hyper responsive, so you can't give medications, you can't give herbs or supplements, like, they can't handle anything. They get sick with everything, and sometimes that can be a hurt, so it's just literally like a hypersensitivity. So, you get rid of the mold, then you can tend to have a lot bigger, armamentarium of weapons to use against the tick infections as well, so that's helpful. And then as far as which one do I use, it really depends on the person, to be totally honest. It depends on the person's belief system and what's in alignment with them, because I have a lot of patients who do not want to use antibiotics if they don't have to. They would prefer to use herbs or anything else. They either had a really bad experience with antibiotics, like really caused a lot of GI distress on them, or the question is, well, if I use antibiotics, I'm going to be using them for at least 3 months. Do I really want to give someone antibiotics for 3 months? Preferably not, although I will for sure because they can work. Kind of depends on where the person
Yeah, and
is.
then you run into
Yeah,
microbiome shifts and
yeah,
all
totally.
sorts of other things down the line.
Yeah.
So,
So I kind of use whatever needs to be used and what's in alignment with the person. Other people are like, no, like I'm really low on cash. Let's use my antibiotics at CBS and Publix. That's what I can afford. So then we only do antibiotics. We don't do any herbs, right? And obviously we try to do the other things too, like we talked about, like all the lifestyle things and all the other. Now when people can, I try to get people to do SOTs, or they're called cure strains now. They used to be called SOTs, or supportive oligonucleotide therapies. And there's like multiple Facebook groups on this. I had several videos out there on the internet. You can even watch them. I have a couple different websites. We have our clinic website, met2medical.life. But if you go to my personal like free access website, it's drclaytonbell.com. I have one that I just did on this for the allergy research group. That are like once a month, kind of doctors meetings. That's about an hour long. It's really informative. And then I have one from the ILADS last year. We did a workshop. Like 4 of us did a workshop on SOTs there. And so if you want to get a lot more information, definitely check that out, and you can nerd out on it like I do. And it'd be really informative.
this has been used in cancer, right?
Yeah, we use them in cancer. Yeah, so that's what they were originally developed for. So RGCC is actually it started as like a research cancer oncology lab. The owners, I guess the gentleman that started, he was actually an oncologist and researcher. But that's where it started as, was advanced cancer testing, and they do these SOTs, or now they're called cure strains, for cancer, and but they started to also develop them for infections too. And so they do them for multiple different species of Lyme, Bartonella, Babesia. You can go for Ehrlichia, Anaplasma, Rickettsia.
And some viruses I've read, right?
Yeah, you can do for viruses too. Yeah, you can do like EBV and HHV6, and you can even do like HIV and Hep B, Hep C, those kind of things too. So yeah, really interesting. And so what these basically are is they're in a nutshell, it's a lot more confusing, but big picture of what they are is they're gene silencing therapies. And so what they essentially do is we would draw a patient's blood. Okay, if they have cancer, then we're going to catch their circulating tumor cells. If they have an infection, we're going to catch the bacteria or the protozoa, which is what the BC is, or the virus, right? And then send it to RDCC lab. What they do is they spin it down, doing PCR analysis. And then once they isolate, if they isolate the DNA, if they don't, they'll just send your money back. But if they isolate the DNA, then what they do is they sequence the genome of these different bacteria, like Borrelia burgdorferi, and they have all these primer sequences. And then what they'll do is they'll create this, basically a DNA-based paranucleotide sequence. That's like 10 to 15 nucleotides. So just think about like looking at a DNA double helix and taking half of that, right? And then what it does is they'll replicate it like say 500,000, 1,000,000 times. Anyway, so basically what they do then is we infuse it into the person. You have to stir water, you give it into an IV infusion, and it lasts for about 6 months in the person. And it can be really, really effective. And what it's basically doing is that little nucleotide sequence is just going around and it's attaching to the messenger RNA of the pathogen of choice. And it's very specific. So it's just made for Borrelia burgdorferi, or just for Borrelia abszelii, or Borrelia terracottae, or Babesia microti or Bartonella henselae. It's not Lyme or Bartonella or Babesia. You have to pick the genus and the species. Very specific. And so that's where sometimes having the bands and the vibrant test is easier because we get more specific bands to choose SOTs from, or keyword strains from, which is nice. Hygienics, we can get some too, but sometimes if it's just a fish is positive or if it's just immunobot positive, but we don't have the species, they have to kind of go looking for it, which is fine. But we might not find out like what the exact species is that was in you, but ultimately I don't really care, because I just want you to get better. But that's basically the way it works. It's a gene silencing therapy. And it's kind of like I talk about it. It's almost like Pac-Man birth control. It's like Pac-Man is just running around the body, and then basically once it finds a little ghost, it just essentially would attach to it and make it basically inert or sterile. It can't reproduce in the
And
body.
shouldn't affect the host tissues
Doesn't
at
no,
all.
it's
Because
not. It's
people hear
not a.
gene therapy and they're like, "Ugh."
It's
You
actually
know?
not a gene therapy, so it's considered an
Yeah.
autologous therapy. So it's actually falls in the same classification as like PRP or stem cell.
Great.
And so it's not FDA regulated. So I like to always just tell people that.
Sure.
But it can't be because everyone's is different, literally. Like every time you get SOT, it's going to be different based on the organism that they isolate and then they make it for. And so, yeah, but there can be really effective. And it basically it only affects that bacteria in the body, right? It doesn't change your genes at all. And it kind of works like the opposite of a COVID vaccine. Some people hear mRNA and they freak out because they think COVID vaccines.
Yeah.
Instead of it inducing mRNA to like create like a protein in your body or create an immune response, it's actually the opposite. It blocks that mRNA molecule from basically
From that specific pathogen.
yeah. So it
Yeah,
basically
great.
can't make an amino acid, so it can't make a protein. So
Pac-Man's
it
great.
won't
I think
function.
people are gonna get it from Pac-Man. That's awesome.
Yeah, it's a patent. Basically.
Yeah. So you do testing, see
But
what
no,
pops positive, and the
no,
patient, and then their blood gets sent off to
mhm,
this laboratory, and they
mhm,
design a specific
mhm,
SOT for
mhm.
that specific
Pathogen.
strain.
Yeah, correct.
Yeah.
Mhm.
Perfect.
Yep.
And then they do an infusion,
Mhm.
and they walk out same
Yes,
afternoon.
yeah, it takes about 30 minutes. The pre-meds
Yeah.
take
Cool.
longer. You give a little, like dexamethasone just to keep the vein tight, just because it's an expensive therapy. You wanna make sure it doesn't
Sure.
you'll have leaky veins, doesn't flow through the vein and get to the interstitial space. So, yeah, but it gets into systemic circulation.
What are these things running per infusion
Yeah,
for
so they're
people?
different. In our clinic, we're probably on the lower end for sure. But that's also because I do all telemedicine in like 7 different states, so we don't have a brick and mortar. So I kind of hate to say that. I'll tell you what we do, and then I'll just kind of give you like a range that I hear other patients talk
Yeah.
about. So we do it for around $2,200 for an SOT, and that's very much on the lower side. I have other colleagues, and I've talked to other patients, and the SOTs tend to range anywhere from like the previous clinic I was with, it was 2,600 an SOT, and then I have a lot of colleagues I work with or patients that are expecting to pay like over 3,000 for SOT. So there's a lot of technology that goes into it, if that makes sense. But I would say the low ball, I've never heard of anything under 2,000, and then I would say 3,000, and probably the middle of the pack is probably somewhere in that 26-ish
Yeah.
dollar range. If that makes
Yeah,
sense.
I mean, you're sending it off to Europe to
The
get
grease and egg,
created,
the
and it's
bags, and
personalized, then it
yeah.
makes sense. And the goal is to drastically reduce the
Mhm,
load on the
mhm,
host and
mhm,
then give the immune system a chance to
mhm.
come back and
Exactly.
gain some of that resiliency back,
Mhm.
essentially, right?
That's right. Yeah, and so what we do is we really, like, kinda double it up. So what I'll do is if they can get an SOT, once again, it's just a resource game, right? And all honest, it's all it is. If people have the money, they get it. If they don't have the money, they don't get it.
Totally.
And so I
Which is
don't
super
ever
unfortunate, but
super unfortunate, yeah,
it's
and
the
I don't
world we live
ever
in right now.
yeah, yeah, and so, but basically what'll happen is they can get a SOT, then I'll double up with the herbs on the back end of that or antibiotics, before we recheck them again, so I can kinda hit them like a 1, 2, 3 and really go after it, be a little more aggressive. People tend to herx less off the SOT too. Now people can have some herxes, and, like, I had a big herx my very first one. I got really familiar with coffee enemas, like, that was a game changer for me to just get out all the toxins and the die off after that. But there's some supplements you can give people that help.
Yeah, and when Dr. Bell says herx, is essentially just the way when your body is when you get a treatment to fight off an infection and either particles of that infection are released or the toxin is released, your immune system essentially responds more aggressively up front. So you have this like wave of inflammatory reaction. You can see this in antibiotic therapy in the hospital. You can see this in all sorts of things. But this essentially this immune reaction to the process of the treatment itself can be you feel a lot worse acutely before you get better, essentially. So, very cool. Is there anything else that you would like for people to know? Also, would you mind just sharing? There's not a lot of providers that do these SOT therapies or have this experience with Lyme and tick-borne infections, let alone personal experience, and also are just cool human beings. So, if you also wouldn't mind sharing where people can get a hold of you.
Yeah, absolutely. I'd love to. So I started to practice 9 months ago called Meta, META. No relationship to Facebook. I honestly didn't know. It was more like the metamorphosis, I mean, like of the human person and spirit as they're healing. But it's metamedical. So you could go to metamedical.life for my personal clinic. I am licensed in North Carolina, South Carolina, Georgia, Florida, Tennessee, Texas, and Colorado. I have a nurse practitioner who's licensed in a couple more states as well. I think New Mexico and Utah and Maine. Anyway, so if you think you have a tick infection, I would highly recommend you see an LLMD though, or like an LL nurse practitioner, PA. The best way to find that would be to go to ilabs.org and look under their provider search. And then you can see where you live and you can find a provider that's close by to you. They can help provide services for you. So that's where I would go. Also, there's other websites out there that help people with Lyme, like Project Lyme, and they have provider searches and everything too. I think those would be the iLads would be the first place that I would go and find someone in your area. As far as SOTs go, you could go to the RGCC North American website, and I believe they have an access link on there. I don't have the URL in front of me to see where SOTs are done, but you could always call like the RGCC North American branch. They're based out of Colorado, but they could connect you to a SOT provider in your area as well. And sometimes what we even do with the SOTs is I have a few patients who are like out in Colorado or Texas, and I have colleagues out there. And so I'll see them virtually. I'll order the SOT. I'll drop ship the test kit. They'll get the blood draw. I'll order the SOT. I'll get the SOT, and then I'll ship it out to like basically a friend who's a doctor out there in
'Cause the
Colorado.
infusion's pretty
It's
straightforward.
infusion, yeah. So they can do it.
Yeah.
They're 3 units, so they can do it there. So yeah, there's other
Cool.
providers. But yeah, that's basically I would go to iLads. Like I said, that's gonna be like your best
Yeah.
resource. Those are everyone's very scientifically oriented there, very legit. And yeah, you could find someone. And the last thing I would say to people is like you can get better. And you should expect to get better. Like this is not a death sentence. This is not, you know, you should not expect to continue to live in this way perpetually. If you can find the right diagnosis and find the right therapy that works for you, and sometimes it takes different tries, right? Like we don't always
Sure.
get out of the part the first time. So yeah, you can get better. That's the
I like to remind people your body is designed to heal.
yes,
Like, it's literally made to work.
yes.
So it can and it will with the right supports. Awesome. Thank you so much. I think people are gonna find this massively helpful for the people that are struggling with this. And I think a number of providers might find it helpful just from an intellectual standpoint from learning. I have trained in functional medicine, and I still didn't have a great comfort level with Lyme. It's just it's a controversial topic,
Hmm.
as you mentioned, let alone complicated medically, right? So, thanks so much for coming
Sure.
on. I
Thank you.
really, really appreciate it personally, and I know a lot of people will.
Awesome. Thank you so much for having me. It's been a
All
pleasure.
right. All right.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.